Hi, my name is Dr. Robin Abramczyk, and I'm a holistic and biological dentist in Heath, Texas. The name of my practice is Smile Ranch Dentistry, and I am here today with my friend Jana Powers, and she owns Powerhouse Wellness, and she is a specialist in fertility. She actually does what's called Maya massage, and I found myself contacting her through my own struggles and trying to conceive. And a lot of people today struggle with infertility issues, and they actually seek mainstream medical treatment such as IUI and in vitro. But there's a very good way to supplement that. It's more of an integrative approach, and I would like for Jana to share with you a little bit about what she does and the history behind Maya massage.
Well, the history behind Maya massage is it's actually come together with a lady named Rosita Arvigo, who is a naturopath who moved to Belize 40 years ago to study the plants. She actually started to apprentice under a shaman there and learned that this technique was being used, and they would have trucks and things that would bring in 40 women at a time from different villages who wanted to have the uterine massage. And so she started, it really kind of lit her up a little bit, and she's like, I need to find out more about that. So she actually apprenticed under him for about 5 or 6 years before he would even start to teach him what he knew. And so the promise that she had to make was that she would always stay in Belize to treat his patients even after he died, because he was a really old man at the time. So she still lives there, and when I went last year to get trained, I actually got to meet her and go to her home. And went on a herbal plant walk at her home, which was very exciting. She's in her 80s now, so she's an older lady. But anyway, so the way that I work with my clients is I have a lot of clients that come in that are trying to get pregnant, and they've been on the journey. Most of them come to me kind of after they've been on the journey for a while and have had ups and downs with that. So I work with people who have never done fertility treatments, but I also work with people who are doing fertility treatments. So I really prefer to work with people before they go down that road, because sometimes you can avoid having to take all the medicines and stuff. But I can also help people that are doing IVF, because it can actually make your implementation rates go up. So I'm happy to help those people as well.
Okay, so when a client does come to you, what can they expect in their appointment?
We finish the intake form and kind of get a feel for what her history is and kind of understand what her goals are. And then the next hour and a half is all hands-on. I do about an hour on the abdomen. I work from the pubic bone up to the rib cage. And the goal is to get any adhesions, any scar tissue, anything that might be blocking good blood flow into both the digestive cavity and into the reproductive cavity. Then I also will do a lot of work around the uterine area, the lower pubic area, so that people feel like that is usually what people are trying to do, is get more blood flow into that area. So I spend a lot of time on that. And I also could give feedback on what I'm feeling, if you might be tilted, if you might be retroverted, based on your symptoms and also what I'm feeling.
Okay, so what other patients would be ideal to come to you? If they have cysts, what other kind of things would benefit from Arvigo?
Right, so I do see a lot of fertility clients, but I do see clients with cysts. In fact, I have a really great testimonial there. A client recently, she's been working with me for about 3 months, and before she saw me, she had a sonogram, and she had a cyst the size of an orange. And after 3 months with me, she went back for another sonogram, and it was completely gone. So she actually avoided her 3rd surgery. She had already had 2 surgeries to remove cysts, and so that was really exciting.
That's amazing. That is amazing. Wow. I have heard from other colleagues of mine who have sought Maya massage that they can tell after they receive their treatment or their massage therapy that they can tell greatly enhanced libido, a lot healthier, more robust. Have you found that in yours as well?
Yes, I've had several clients report that back, and a lot of that has to do with just getting better blood flow into that area, so your hormones actually, so along with blood flow, you also have lymph, and then your hormone system is also enhanced as well. So it can also help with people who have cycles that are off, heavy cycles, pain.
So teens, for instance, teens that are having heavy menstrual cycles or a lot of pain, would they be a good ideal?
Yes, that's actually an area that I really want to expand in, is to getting moms to bring their teen daughters in, because there's a lot of teens out there that are missing school, missing sports, because they're at home, you know, with a lot of drugs in them and heating pads and everything, and that really can be avoided with some simple massage. And then I also teach all my clients how to do a massage on themselves, and that really is empowering. So once we kind of get the person to the area where they want to be, they're not in pain, you know, that kind of thing, then they can continue to keep that everything flowing. Because high impact activities can actually tilt the uterus, like running, jumping, volleyball, that kind of thing, so that they can continue to keep it in place for themselves.
Okay, wonderful. So if someone were interested in speaking with you and receiving treatment, how would they reach you?
The best way to get to me is my website, which is janapowers.com. So it's Jana with one N. And that way they can get to me. They can either contact my Facebook, they can call me or text me, and then also you can also book online as well.
Okay, and your phone number?
It's 214-926-7350.
Okay, wonderful. And if you have questions, you can also call us here at Smile Ranch, 972-772-7645. And Janet, thank you so much for sharing.
Thank you.
And thank you for joining us today.